We do have the audio back now for the governor's interview, so let's take a listen as he talks to Amanda Dugan.
Has said he does not plan to wear a mask. Do you?
Well, listen, this is a voluntary recommendation that is right for certain people, especially those who may be gathering in situations and where they could be exposed to a transmission of the coronavirus. And so I would say if you're in public, this is something that you may want to choose as a strategy to make sure that, for one, you're protecting yourself and your life, but also you're doing your part to make sure you're not transmitting any type of disease.
Governor, the Texas Workforce Commission has been inundated with calls. Its website has crashed. Are you satisfied with the Workforce Commission operation right now? And what has been your direct involvement with those problems?
Well, listen, they are responding more robustly than ever before. Understand what happened here, and that is in one day, they had well over 1 million applications for unemployment benefits. As a result, because they were inundated so much, they had to add hundreds of new staff to help respond to this. They are now catching up with the program. I want to make clear to all your audience, and that is everyone, regardless of when they apply, will still get all of their benefits, and the benefits they get will be even more than before. Money provided by Congress.
So we are hearing cases of people with no medical problems who are not elderly getting COVID-19 and dying. Sadly, they would not be priority to get tested. Now, is there any discussion at the state level of changing the criteria for prioritizing who gets tested? And will Texas ever go to the point where anyone can get tested without doctor approval?
For one, we are expanding those who are capable of being tested. However, this is so important for your audience to learn, and that is we have more than 29 million Texans. There is no need to test all 29 million Texans, and let me tell you why. The testing rate is about 99% will test negative. If you get a test and it proves negative, it really doesn't tell you anything, because you could an hour later contract COVID-19. The only way you would have any consolation knowing you don't have it is to get tested pretty much every hour of every single day. The goal of testing is to identify who does have it so those people can be isolated. That is exactly why people have to show some level of symptoms consistent with COVID-19. Doctors are able to determine do you have a flu, or do you have COVID-19, or some other issue, so they can pre-qualify the people who are tested.
All right, Governor, this next question is for parents. There's been a lot of confusion about whether child care facilities are essential businesses. Now, can you clarify if you consider child care an essential business?
So our essential business categories come from Homeland Security. This child care falls under that category for this reason, and that is especially as a service for all of our healthcare workers. In this war against COVID-19, the healthcare workers are on the front line, whether they be doctors or nurses, staff, whatever it may be, and they may have kids at home that would detain them from being able to go to work. So we need to be able to provide these child care services at a minimum for those who provide the essential services, whether it be healthcare services or the people who keep the lights on and the power on, the water running in your community.
Absolutely. All right, Governor, thank you again for your time. All right, that full interview with Governor Greg Abbott is online for you. Coming up here on KXAN News at noon, measures to control the spread of the new coronavirus are putting a dent in Easter weekend plans. We're going to explain how people in Austin are adjusting to the changes this year.
All right, everyone, that was the interview with Governor Greg Abbott about the state's ongoing response to some of the issues it's facing during the COVID-19 pandemic. And we'll just recount kind of the things that he said if you tuned in a little late to that conversation. He said that he was asked, rather, if he would be wearing a cloth face covering in public. He said that really that is a recommendation at this point by the CDC as well as state officials. And he said that in public, if you're going to some place that might be potentially crowded, like the grocery store, for instance, then that may be when you choose to wear a cloth face covering. And really that's to protect other people, because sometimes these COVID-19 patients don't show any symptoms at all. So if you are covering your mouth, you are potentially protecting other people around you from getting sick and getting infected as well. So that was what he said first. Interesting to note as well, as we hear that more than 6 million people, an additional 6 million people, filed unemployment claims last week. He said that in Texas alone, the Texas Workforce Commission received 1 million jobless benefit applications in just 1 day's time. We have gotten many emails from people saying that they are having a hard time getting through the hotline number as well as online, and there have been issues with the application process online because there is so much demand for these particular benefits. He said they're addressing that, and they're bringing in additional staffing and making that availability for people to call in or to apply online 7 days a week. That is something that we're working on right now. There's a story on our website, KXAN.com at the moment, and on our news app, so please download that if you haven't. The governor also announced yesterday during a press conference at the state capitol that more than 250 Texas House and Senate staff members have now transferred over to working on processing jobless applications and claims as they're trying to beef up staffing to handle this incredible demand for these particular benefits. And he also said at the moment there is no need to test all 29 million Texans for COVID-19 at the moment, reiterating again that only people who are showing symptoms should get tested at this moment. However, we should all act like we have it, and that is to only protect ourselves and other people around us. So practicing that social distancing, staying at home if at all possible, and only going out for those very essential activities like going to the grocery store or filling up your car with gas. So if you'd like to see more of this interview, we're going to post the full video on our website, KXAN.com, and the KXAN News app. We do appreciate you all watching here on our streaming platforms. We're going to take down this stream, and we'll see you back here throughout the day. Once again, thank you for trusting us to share this information with you and for you all to come back to us to hear it. Please stay safe, stay healthy, and if at all possible, stay at home. Thanks again, everybody.